Hello, and welcome to the Chamber Foundation's Path Forward series. Today, we're pleased to welcome back CDC Director Dr. Rochelle Walensky. She previously joined our program in May of 2021. A lot is different today than it was back in May. Most notably, we as a society have largely learned to live with COVID. Dr. Walensky, we all just read in the news that you yourself have a rebound case of COVID right now, and yet you're here on the job. I sure hope you're feeling okay. We appreciate you being here. When I talk to business owners all over the country, COVID is no longer at the top of the list of concerns. And for some, it's not even on the list of concerns. So my first question to you, Doctor, what is the state of the pandemic right now? What should employers be thinking about as we head into winter? That's where I want to start, because I think if there is a message you think the business community needs to hear, you have a really attentive audience right now. So let's get started.
First of all, thank you so much for having me back. I'm delighted to be back here with you, and delighted to have this still on the radar of critical business owners. In terms of where we are right now, you are right. We are in a very different place, fortunately, than we were in May of 2021, and we have traversed some very hard terrain since that period of time. In terms of where we are now, we are tracking at CDC about 40,000 cases of COVID every day. Our hospital admissions are at about 3,200, and our deaths are somewhere between 350 and 400 per day. While that is markedly different, markedly lower than we have seen in some of our prior high peaks, of course, I am still personally disturbed that we are at 400 deaths a day and that continues. In terms of cases, we recognize that we are testing using PCR tests much less than we previously did. We had been using PCRs, up to 3 million PCRs every single day. Now, with the more and more use of rapid tests, we recognize we're not tracking every single case. But as a colleague of mine said, and I really think it merits repeating, we don't need to count every raindrop to know how hard it's raining. So we're following these trends very carefully, but we still are doing somewhere in the 300 to 400,000 PCRs a day. So we really do have a good sense of how our cases are trending. I think what's most important to recognize right now in this moment is part of the way that we traversed from where we were in May of 2021 to where we are today is through many people getting infected, many deaths, of course, but importantly through vaccination. And it is that immunity, both through natural infection, but really through vaccination, that has allowed us to be where we are today, where we are living with this virus. What's important about that is we know that immunity can wane. We know it wanes over time. And so in this moment right now, what I'd really like to encourage businesses to do is to encourage vaccination among people within their businesses. Because if people are able to remain up to date on their vaccines, and that includes getting their most recent bivalent vaccine, then that immunity will last longer. It will likely be broader, and we will likely be able to maintain that immunity and maintain where we are in living with this virus. And I would say that's true both for COVID vaccination, but also for flu vaccination. I know we'll touch on that later.
Thank you for that. Help the audience and me understand a little bit more about that horrific number of deaths a day. You know, one of the things we've talked a lot about on this program is that any death of a loved one is certainly tragic. It can be hard to understand a death number. How does that compare to a typical flu season? What does that tell you about where we are in the pandemic? So can you help us interpret that sad number of deaths a day?
Yeah, it is still far higher than we see in an average flu season. And a bad flu season, we see somewhere in the 20,000, 30,000 deaths. This is still far higher than that, even if you were to take this over a full year. And part of the real challenge here is that we are seeing deaths that are occurring in people who have numerous chronic medical conditions, and that an additional infection is something that may turn something that they are able to stably live with to something that they are not. And so what we really do need to do, especially for those who are elderly, who have multiple chronic medical conditions, is really critically important, not only that we maintain that vaccination level, but also we use our tools that we have now that we didn't have a year ago, 2 years ago, if people do get infected. So we have rapid tests to understand whether symptoms whether symptoms are indicative of a COVID infection. We have vaccinations, of course, for prevention. And then importantly, we have things like Paxlovid, which if taken early in the disease course can also change that course to prevent severe disease and hospitalization.
So, one of the questions we get from employers is, do I really need to know if I have the flu or COVID? If I don't feel well, do I just stay home, make sure I don't infect somebody who is vulnerable in the population? But do I really need to know? Is your answer yes, because of these therapeutics?
So first thing I would say is the most important thing you can do for both COVID and for flu is prevention. So getting your COVID-19 vaccine, getting your influenza vaccine, both critically important in terms of prevention. But as you said, it is important actually just to know which one you have, and partially because, well, importantly, because we have therapeutics for both. And you can take also Tamiflu or Tamiflu for influenza. You can take certainly Paxlovid if you have COVID. And they work better the earlier you take them in the disease course. Of course, differentiating them, they may present symptomatically very similarly, but differentiating them is important because you know which therapeutic to take. And also specifically for those who might be older, again, those who have chronic medical conditions, comorbidities, you really do want to prevent severe disease in either of these conditions. So prevention, really important, get those vaccines. Early diagnostics, we have rapid antigen COVID tests that you can take at home. We certainly have rapid flu tests that you can take from your healthcare provider, and then getting that therapeutic if you're eligible.
It comes down to, as I understand it, two things, right? One, trying to make sure that people who could get really sick from this, either from the disease or in some way of long COVID, which we can talk about later, and making sure those really vulnerable people don't get it. But also because we still have the issue of the more it's around, the more variants have a chance to develop. And so talk to us a little bit about that second part, what you're seeing in these variants.
Right. So it is the case that the more it's around, the more virus you have circulating, the more likely it is to have a mutation, to result in a mutation that gives the virus an advantage. We are now, over the last several years, we have seen the evolution of the original strain, and then the Alpha variant, and then the Delta variant, and then the Omicron variant. The Omicron variant was the one that came in November and December of last year, around Thanksgiving, really peaked in January. Since January through most of 2022, what we have been seeing are subvariants of the Omicron variant. They all have Omicron as a parent, but these subvariants are leading to what we call sort of evolution that has resulted in certain amino acid changes, certain changes that give that variant an advantage, or that subvariant an advantage, generally a transmission advantage. They become more transmissible. They may become more able to evade our therapeutics, more able to evade our vaccines. And so it is the case that we're following these subvariants very closely. We every week at CDC release what we call our Nowcast, which shows you the state of these variants and subvariants across the country in the United States. And we are following them for how well our therapeutics work, our diagnostics work, and our vaccines work in the face of these new subvariants. Maybe two I will highlight right now. We've been following the BA.5 Omicron subvariant for the last several months. That's the one that led to a slight increase in cases over the summer. Since then, we've had two subvariants, the BQ.1 and the BQ.11, that you may have heard about. Again, sublineages of this original BA.5. And the reason we're watching these very carefully carefully is because they do evade our monoclonal antibodies. That is our bebtelovimab, one of our monoclonal antibodies, as well as the Evusheld. And that's the preventive monoclonal antibody that we give to folks who either can't tolerate vaccines or for whom vaccines will not work, severely immunosuppressed.
So there may have been a lot of medical vocabulary words in that. Break it down for, you're describing this to your relatives. How do you describe the variants to people who might not have a thesaurus with them?
Yeah, perfect. So the thing that's most important is we continue to follow these subvariants, and we still believe that vaccination is important, and that getting vaccinated, especially with the bivalent vaccine, will lead to better protection, more protection against severe disease and death. If you were to get one of the viruses that is circulating right now, there may be a chance that some of our therapeutics may not work as well, including our monoclonal antibodies. This is where it becomes really important for us to seek out medical attention and really to consider whether Paxlovid, early treatment with Paxlovid, would be right for you.
Thank you for that. And so going back to this bivalent vaccine, I think we hear a lot of people saying, I've had all my vaccines. The people I know who get COVID aren't that sick. I don't know that I want yet another one, and so it feels, I don't know what the current statistics are in the take-up rate, but I think it's been relatively low. So a couple questions. What is the take-up rate? What should we be doing about that? And how do we get that message out?
So we've had about 24 million people who have gotten the vaccine, this bivalent vaccine. First, let me just say, this is the first time in the COVID pandemic where we have a vaccine, this bivalent vaccine, where the actual vaccine matches the circulating strain that we have right now. So we have BA.5, and the vaccine is intended to target BA.5. And that is really critically important. In laboratory studies, the implication of that is that the vaccine might work even better. So that was the reason and the rationale for this bivalent vaccine right now. What we know from all of the data we have seen so far is that over time, your protection from a prior vaccine wanes. And so why get your bivalent vaccine right now if you previously before the summer had vaccine doses? The reason is because right now is the moment heading into the respiratory virus season, heading into holiday season where people gather, where we want you to bolster your protection so you have a really good dose of strong protection. We restore your waned immunity, and importantly, we restore it against that variants that are circulating right now. So we think it will broaden your protection, it'll lengthen your protection, and it'll bridge you through that pretty vulnerable respiratory virus season of the winter.
We're seeing a lot of news about cases being up in children. And as you just mentioned, not just COVID, but also the flu, RSV. And so can you talk a little bit about infectious disease in children and pediatric care? Is there enough pediatric care out there to take care of these sick kids?
So every year we head into respiratory, we in healthcare head into respiratory virus season, and we are concerned about numerous respiratory viruses. RSV, respiratory syncytial virus, is a virus that infects our youngest kids. It actually can infect anyone, but it's our youngest kids that are more likely to have severe disease, as well as our elderly. Also, influenza. Every year during influenza season, we follow closely our influenza rates, how influenza is affecting hospitalizations. Again, with flu, our youngest children are folks with comorbidities, as well as our eldest. And then, of course, with COVID, highest rates of severe disease amongst our eldest and those with comorbidities, and even our really young children. What's happened in this current moment is we had several seasons where many people did not get exposed to the standard respiratory viruses. People were either undergoing mitigation strategies, they were home, they were masked, they were not in school, they were not in daycare, and all of that regular exposure that usually happens that bolsters immunity from year after year didn't happen. Just to give you a sense, almost every year in a regular year, about 80% of children are infected with some form of RSV. If you go 2 years without getting that infection, without getting that protection from infection, and then all of a sudden, boom, everybody from 0 to 3 years gets RSV, you see the impact on healthcare. And that is exactly what is happening right now. And that is why in this moment, it is so critically important for us to bolster our protection with flu. We don't have an RSV vaccine quite yet, although some promising developments underway, but really to prevent those things that we can prevent, because we do know that our national immunity for all three of these has waned or is relatively low. And we're really trying to bolster that protection for all of these respiratory viruses that we can.
It's an important point, right? We had a low flu season last year, or the year before, because people weren't out, they weren't about, they were masked. And so all of our immunity is kind of down. I understand what you mean there. Talking about pediatric care just reminds me of hospitals. When this was all breaking in 2020, we were watching signs of overwhelmed European hospitals. And I think a lot of the fear in the United States was driven by looking at fears of rationing care and what we were seeing from some of our friends in Europe. I think one of the things I continue to hear from hospital CEOs has to do with the nursing shortage and labor shortage and kind of a confluence of events that makes hospital crowding and the ability to care for patients even more difficult. So what are you hearing from hospitals, and how should the public be thinking about it?
Yeah, I think you're exactly right. And in fact, prior to my coming to CDC, I was in those hospitals in Boston as we were tackling those challenges in March and April of 2020 for many of the similar things that you have seen. And so part of what we are working to do is on the prevention front, because we know that in a context of bed shortages, it's not just the beds, it's the people taking care. So we need to do two things. We need to do our best to keep patients out of the hospital by protecting them through vaccination. And we need to do our best to keep healthcare workers well, so that they are able to work also through vaccination. And that your point, I think, is a really important one. We need to do the prevention on both sides, which is why in this moment, I think as people are sort of considering what is most important to me right now, coming out of a pandemic, we have all of these other challenges, but keeping a healthy workforce really should be a top priority, because those challenges can't be tackled without the health of that workforce.
I think it's a really crucial distinction, because as we think about, again, the number of people who've had COVID and say, it was bad, but it was like a cold or a flu, the fears of ending up on a respirator seem distant, right? But I think the concept of we have such a labor shortage already in these hospitals that it could be a nurse or a doctor that you're making sick. It could be part of the critical infrastructure that you're making sick. And so I think it's an important question. I think solving the nursing shortage in this country is a big piece of what we need to be working on, I think, with this administration. But you're talking to an audience of small business owners, of chambers of commerce across the country, other employers. How should employers be thinking about this upcoming flu season with COVID on top of it, and the fact that we see a lot of understandable absenteeism when people have to be home caring for sick kids? So how should we be thinking about this as employers?
Yeah, sick kids, sick parents. I would say one of the other challenges in your not only getting sick, and it's really devastating to think of who you might have otherwise infected. Going into the holiday season where we anticipate that we are going to be around loved ones, the last thing you want to do is be the person who unwittingly, unwantingly entered a household where you brought infection to that household. In terms of employers, one of the things I think that is so important is not just the encouragement of vaccination, but the facilitation of vaccination. So, of course, we would like employers to encourage their employees to seek vaccination, whether at work or in the community, and whether those vaccine clinics are set up at work. But one of the important things that I have found is to have somebody knowledgeable in the workplace as to the why, to be able to answer the questions. One of the things that I really do think is true is people have reasonable questions. why do I need another one if I just got vaccinated in, the spring? And the answer is because the bivalent vaccine is targeted now to the circulating variants, and even 5 months of waning, you may not be well protected if you don't get this updated vaccine. So some of those questions are very reasonable, very rational questions. And if you have somebody who's informed in the workplace to answer those questions, people may be more likely to go ahead and get vaccinated. So making vaccines available, certainly consider the co-administration of the flu and the COVID vaccine together. Those can be safely administered at the same time. Consider some workplace employee vaccinations or some leave time during work hours to get vaccinated, or even providing transportation to offsite vaccination sites, and then to offer some flexibility and non-punitive sick leave if people don't feel well the day after their vaccination, because we do know some people drag a little bit after that day after vaccination.
So I think if you're an employer and you want to have good information for your employees, we've seen this throughout the pandemic, people trust their employer for facts about what's going on. The employer's next question is going to be, well, where do I get them? Where do I get reliable information? And I think this has been part of the problem throughout the pandemic, has really been a dearth of reliable, consistent, good messaging. And so what's your advice for where an employer should turn?
So certainly we at CDC have a load of toolkits on our website for all sorts of facilities. We have posters, we have flyers available in numerous languages. So that is one place. Not everybody wants to go to a government source for that information. And a lot of the medical societies also, whether it's the Infectious Disease Society of America or the American Medical Association, as well as local hospitals, have many resources. So if you are working, in Washington, D.C. and want to go to, one of the academic medical centers in that area, that may be a place to go, as well as the local health department. So there are a menu of places from which you can get resources. And if you have those resources that are sort of branded with something will resonate well in your workplace, that might work well.
It's interesting because I think one of the things that's hard is that there's so many government employees in particular who are able to work remotely or who are still working remotely at this point. And in the private workforce, we're not seeing that, right? We really have a lot of jobs where people need to be on the front lines. And so I hope that we're doing a good job in communicating with government what's hard about bringing people back to work and needing people at work and on location, particularly in customer service jobs and manufacturing jobs and jobs that just don't have a choice. We talked about hospitals, but a lot in hospitality, where people just have to be front and center. So, you're a major employer, you have employees. What are you doing to help keep your employees safe as they come back into live work?
We have done webinars, and we've done vaccinating. We have plenty of vaccination clinics at CDC, both for flu as well as for COVID. And we have opportunities for people to ask questions. I really do think that there are many people out there who have reasonable questions and want to have those questions answered before they go ahead and roll up their sleeve. And we can't always predict what they're going to be, but having somebody who's up to date on the information so that they can ask those questions. What are the latest data, for example, on safety of the bivalent vaccine? We at CDC are going to be publishing just this week data on the safety of the bivalent vaccine, a look at the first over 10 million people who have been vaccinated. And so that will again provide reassuring information. We have an extraordinary amount of safety data from the mRNA vaccines through the course of this pandemic, and we will have yet another piece of information. So is safety the question? Is the why do I need this now the question? Is the, people, I've heard people who got vaccinated but then got infected. That is true. What you hear much less of is people who got vaccinated but then ended up with severe disease. And what we are working now to demonstrate is really how well these vaccines work against severe disease.
Yeah, I think one of the things you hear too is fear that we haven't had enough time under our belt to understand the long-term implications of these vaccines. vaccines, right? And so we've had some of the manufacturers and makers and scientists behind the vaccines on this program trying to dispel some of that. How do you answer that question?
We have, I think, through this pandemic, had the largest safety network of any vaccine, truly. Over 600 million doses in this country, billions of doses, or over 1 billion doses internationally. One of the examples that I like to sort of demonstrate is how well our safety network has worked in finding very, very extraordinarily rare events through our vaccine safety system. We have numerous networks that follow the vaccine safety system. Our VSafe network, that's the network that pushes out the app on your phone that says, do you have symptoms? We have our adverse events network. We have our safety data link network, which looks into hospital records. So we have, for those who report, so we have a menu of different ways that we are following vaccine safety, and hundreds of millions now of people who have received these vaccines. And so we continue to follow and we continue to report. We have had numerous ACIP meetings publicly available. Again, the webinars are available online for viewing, that have gone through all of the safety signals and all of the safety data that we have through over 600 million doses given.
So I'm going to turn to a couple of audience questions, if that's okay. One audience member is asking about, I'll read this to you. BQ1 and BQ11 are growing rapidly, and BA.5 is declining. How can we update vaccinations quickly enough to keep with a virus that's mutating very rapidly?
Right. So that's actually a really important question. And it is like, we do have this moment right now where, just to be clear, BQ1 and BQ11 are both subvariants, sublineages where the parent is BA.5. Our current vaccine is a bivalent vaccine that includes BA.5. So we anticipate that we will still have protection of BQ1 and BQ11 with our bivalent vaccine. Of course, we at CDC are monitoring this very carefully. We have the responsibility of doing our vaccine effectiveness studies, and those studies are underway. Among the questions that we ask is, what is the protection that we are getting from our vaccines against severe disease, hospitalization, and death? Fortunately, those numbers are relatively low right now, but these are the data that we're going to be following over time.
Dr. Walensky, it's interesting thinking about therapeutics. We've had different doctors making different recommendations about who should use them. People who say, if you're relatively healthy, there isn't a lot of testing done on how well the therapeutics do for people who have been fully vaccinated in the long term. So, get through your course of illness and you'll be okay. And of course, we're seeing maybe some evidence that rebound cases are more prevalent in people who use the therapeutics. So how are you weighing all of this, both as a physician and CDC director, in terms of how you're advising who should use a therapeutic and when?
Well, certainly, again, I'm going to harp on the vaccine part first. The thing that's most important is get your vaccine, because that will protect you against severe disease. What I would like to encourage people to do is to reach out to their provider, if they have one, or to their pharmacist, to sort of get the advice of that pharmacist or that provider, should you have a positive test. Now, first thing to say is, if you have symptoms, test early, because these therapeutics work better the earlier we give them. In terms of the one I think that people have talked the most about, and that is Paxlovid and this rebound issue that you speak to. What we have seen, and this I think is really important, is that people who've been vaccinated, people who've gotten Paxlovid, they are not ending up largely in the hospital and dying. we can prevent those really severe outcomes with both vaccination and Paxlovid. And so given in this moment where we still have 350 to 400 deaths every single day, where our vulnerable are the ones who can't take yet another, comorbidity or another infection, it is critically important that we get those folks Paxlovid early. And so that's really, in my mind, the most important thing. Those who are elderly, those who have comorbid conditions, to really think about getting that test early and getting that Paxlovid early. There is some chance that if you were to take that Paxlovid, that you might rebound your infection. If you do, generally the case is that you rebound with mild disease. You rebound that doesn't land you in the hospital. And so in all of this, the most important thing is to make sure you're well on the other side of it. And Paxlovid is an important key to making that happen.
Thank you for that. Let me pull up for a minute and say, so as we head into winter, there are a lot of headlines about a triple threat, and we talked a little bit about children and what's going on there, but how are you thinking about the forecast for this winter, both with COVID-19 and flu?
I'm chuckling because there's a famous line that says, you've seen one flu season, you've seen one flu season. So we don't always know what's going to happen with flu, and we certainly know that COVID-19 has given us some curveballs. Here's what I can tell you about where we are with flu right now. Right now, we are seeing an early flu season. It's mostly influenza A. We have, or at least we've seen early flu hospitalizations. We've seen higher rates of influenza hospitalizations at this time in the year than we have since 2010-2011 season. In the South, where they get flu before us, we also saw an early influenza season, and it didn't necessarily end up more severe. It just ended up being early. That doesn't necessarily mean that that's going to be where we land. It doesn't always predict where we land, but we are starting to see, especially in the South, especially in the Southeast, flu ticking up. We did tragically have our first pediatric death of flu this last week. And so again, this is one of those places we know that vaccination against flu also protects against severe disease, hospitalization, and death. There is maybe just a minute on the flu vaccine to say, some people say, well, when it's not a good match, it doesn't work. And what our data consistently demonstrate is even when it's not a perfect match season after season, we have seen that people who have gotten the flu vaccine tend to have less severe disease than people who did not. So we don't have to have a perfect match to have a really important reason to get flu vaccine. And in terms of what we are anticipating, we're seeing RSV much earlier than we normally do. We've seen flu now earlier than we normally do. And we are heading into cold winter months, respiratory virus season. We do know respiratory viruses tend to thrive in those winter months. And so that's really why we're trying to do all that we can. Maybe one last thing is I think as we just talk about all of these respiratory viruses is one really important thing that businesses can do is to ensure that they have good ventilation systems in their business workplaces, because that really does make a difference in terms of filtering out pathogens so that there are not those pathogens circulating.
I really appreciate any advice for employers. We had jobs numbers again today, and there are still 5 million more job openings than there are unemployed workers. And so businesses are scrambling for workers, and having sick workers sidelined is really a problem for our economy and for communities and job creators across the country. So I think any advice for employers on how to keep people from getting a cold, a flu, COVID, and certainly how to protect our most vulnerable from getting very ill, I think is super important. Before you leave us, let me ask you a question. So, you and I have done this program when the pandemic was at a much more critical, maybe scarier place. We still want to get people good information and good advice that's out there. What makes you optimistic right now? What innovations are in the pipeline? What are you seeing that makes you optimistic about the pandemic and the hope that perhaps the next time you and I are on this program, we can talk about something else?
Maybe just one other piece of information for businesses I do want to convey is that we at CDC last February launched our COVID-19 community levels. And this is a place where you can go to sort of get a sense as to how your community is doing, how your hospitals are doing, how much severe disease is showing up in those hospitals. Are they getting overwhelmed? And it's those COVID-19 community levels that I use as a benchmark for how is my community doing? Should I think about masking policies? Is there enough infection and enough illness out there that we may want to start implementing masking policies? So I would encourage you to go to cdc.gov. At the top is our COVID-19 community levels. You can type in your zip code, type in your county, and get a sense as to what's going on in the community around you. And I think that that's actually a really important thing for you to understand and to consider in terms of policies. As I think about what makes me optimistic, certainly we're in a very different place right now. Clearly COVID is not the disruptive threat that it once was. We are not wiping down our groceries. Our children are in school. Our businesses are getting back, and they are back. And people really have come back to their more normal routines, and they've done so safely. Why is that possible? Because we've had effective vaccines, because we've had booster vaccines that have allowed us to maintain that immunity when it might have been waning, because we have therapeutics, because we have antigen tests, we have access to those tests. So it is the case in this moment, in early November of 2022, that if you get COVID, you can avoid being a serious case by properly using the tools that we have. And we as a society can now prevent almost all of the deaths that are happening. So, what I think is really important through this pandemic, people have learned a lot of scientific jargon, but they've also been empowered with their own health. We can roll up our sleeves and get vaccinated. We can take tests in the comfort of our own home. We can present for care. We can receive Paxlovid. There is still a lot of work to be done here. We have a lot of work in our public health system that we need to do to bolster our public health system, to learn from the last several years. More can be done, of course, in influenza and other areas as well. But I think that there's a lot of reason to be optimistic about the tools in our toolbox right now.
Thank you for that. We're really proud of it. We think a lot of those innovations, if not most of them, were built with the private sector. And we're really proud of our members and businesses across the country who stepped up so quickly. So you're right. And we appreciate that shout out. It's part of what makes me optimistic every day, right? Is that there are job creators in every community across this country who want to solve problems and come up with big ideas. And we're delighted as a U.S. Chamber to help them do that. And we're really appreciative, Dr. Walensky, of your time. As I said, the worker shortage is real. Making sure that people have workers through the winter is important. So any advice for employers you have, we want to get out there, and we appreciate your time. Thank you. And to all of you, thank you so much for tuning in. Our next episode will be December 13th. And in the meantime, take good care.